So in my practice, we do see a lot of general orthopedic problems like ganglion cyst of the finger, carpal tunnel syndrome. When it comes to trauma, we do see a lot of distal radius fracture of the wrist as one of the most common fracture that we see. And of course, injury to the knee such as ACL injury, sprain of the ankle, and rotator cuff injury. In the elderly, we do see a lot of osteoarthritis or degenerative joint disease. So it mainly affects the knee and also the hip. And in the elderly, fall, we do see a lot of hip fractures. So as we age, the common orthopedic issues that we see is commonly osteoarthritis and also osteoporosis, which is weakening of the bone, having an increased risk of fracture. To prevent that, it's good to maintain a healthy physical activity of weight-bearing exercises and also some resistant training exercises. For weaker individuals, they should do this under supervision, as for example, by a physiotherapist. Having a healthy diet which is high in calcium, rich in vitamin D, and cessation of smoking and avoiding alcohol is also important factors. In individuals who are elderly, at home we should always practice fall precaution. So having railings in the bathroom and make sure they do not fall is very important. And for osteoarthritis, we do know that having a healthy BMI and not overloading your knees and doing physiotherapy and maintaining a healthy muscle bulk will improve in preventing osteoarthritis. Well, I'll give osteoarthritis is one of the conditions because osteoarthritis of the knee is actually a degenerative disease where you have wear and tear of the knee cartilage. Treatment options will be depending what stage the patient come to us. If it's early in the disease, so you do need to come to us to make a diagnosis. In early disease, we can do conservative management, which is non-surgical management of physiotherapy, supplements such as glucosamine, chondroitin, hyaluronic acid. We can do therapeutic knee injections, such as using hyaluronic acid, platelet-rich plasma, and we can also use a functional brace to correct the deformity of the knee to elevate pain. If a patient have undergone conservative management and still suffers severe pain and unable to perform their day-to-day activity, surgery is a good option where we can do total knee replacement to elevate the pain and return patient to good function. If you are being admitted for a knee replacement surgery, you'll be admitted one day before where we'll do your blood test and make sure you're fit for surgery. Next day, the surgery will take about 2 hours. And most patients, the day one after the surgery, they should be able to stand up and walk with some assistance of physiotherapy unless the pain is very severe. And the estimated length of stay in the hospital will be about 2 to 3 days depending on the patient. And patients should be able to walk to the toilet and comfortably before they go home. Estimated patient to be able to return to function is about 3 to 4 months after the surgery. So for example, if a patient have undergone total knee replacement, my surgery is only half of the battle. The second half of the battle is post-surgical rehabilitation process. If you don't do physiotherapy right after surgery, we cannot maintain the suppleness of the joint and we can develop joint stiffness, joint swelling, and the overall outcome and function of the patient will be poorer. So physiotherapy is very important as part and parcel of your total knee replacement surgery rehabilitation. So the latest advancement in joint replacement surgery or arthroplasty is actually including robotic assisted surgery, where it is actually a new technique developed to help us make the surgery a bit more accurate. Having robotic assisted surgery helps us make the cut more accurate, reduces soft tissue damage, and also makes us plan the surgery better. Other advancement that we have is actually custom-made implant, where we do a CT scan of the knee to customize this exact size for the patient, where our cutting blocks and the implant is specific for the patient and is more accurate. In rather experimental advancements, some countries have started to experiment with 3D printing in joint replacement surgery and to correct severely deformed knee by using 3D printer. My advice for people suffering from bones and joint issues is to seek treatment early. Come to your local orthopedic doctors, get your problem diagnosed, because by knowing the issue and by knowing what stage of the issue, proper treatment can be started early and even prevention so that you might not need surgery actually if you're diagnosed properly. And if you do need surgery, seeking early treatment does make things less complicated as the severity deteriorates later.